Hello everyone, my name is Gretchen Duyag and today I'm going to perform vital signs. Vital signs are measures of the body's most basic function. It is the first step for any clinical evaluation. Healthcare provider must understand the various psychological and pathological processes affecting these sets of measurements and their proper interpretation. This is useful in detecting or monitoring medical problems. Vital signs can be measured in medical setting, home, or etc. The four main vital signs routinely monitored by medical professionals and healthcare providers are body temperature, pulse rate, respiration rate, and blood pressure. These are the equipment used for measuring vital signs. First is the sphygmomanometer or the PP apparatus. Second is the thermometer for body temperature. Third is the watch for pulse rate and breathing rate. And last is the gloves and disinfectant wipes for cleaning the apparatus. Heart rate is a measurement of the heart, or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract the flow of the blood. Taking a pulse not only measure the heart rate, but also can indicate the following: the heart rhythm, the strength of the pulse. The normal pulse rate for healthy adult ranges from 60 to 100 beats per minute. Respiration is the number of breaths a person takes per minute. The rate is usually measured when a person is at rest or simply involved counting the number of breaths for 1 minute by counting how many times the chest rises. The normal rate for adult is from 12 to 16 breaths per minute. And today I'm going to show you how to accurately take the pulse rate and respiration rate. But first, sanitize the equipment used and wash our hands. Then introduce ourselves to the patients and ask patient's identification. My name is Gretchen Duyag. I am the medical office assistant here. I will be taking your vital sign. Is that okay with you? What is your name and your birthday? Gerald Abdagnipa is my birthday, October 20, 2000. I'll be taking your pulse rate, respiration rate, temperature, and blood pressure. First, I'll be taking your pulse rate to see how well your heart is working. The patient sit and support their arm extended out and use your first three fingers to feel the pulse in the artery and lightly touch and feel the bouncing of the pulse. Count the beats for 30 seconds and then double the result to get the number of beats per minute. In adult, the most common site to use or to check the pulse is in the radial artery because it's really easy to access. Taking pulse is not just like counting the rate, but also we're going to be feeling the strength of the pulse. So her pulse rate is 82 and it's regular. Record it in her chart and wash your hands. And now we're going to do is we're going to keep our fingers here because what we're gonna do next is to check the patient's respiration. If you tell patient that you're going to take the respiration, they may feel conscious that can affect. So we're gonna stay the same position and assess the respiration. To assess respiration, we're looking for the rate. A normal breathing rate of an adult is 12 to 20 breaths per minute. We're also looking at the depth if it is labored or unlabored, in the rhythm if it is regular or irregular. The easiest way to do this is look at the patient from the side and watch their close downs. Are they rising and falling? Because one rise and one fall equals to one respiration. Count that for 30 seconds if their breathing rate is regular and then multiply that by 2. But if it was irregular, you would need to count for 1 full minute and then document your findings. The patient breath for 30 minutes is 8, so multiply it by 2 equals 6. Normal body temperature of a person varies depending on gender, recent activities, food and fluid consumption, time of day, and in women, the stage of menstrual cycle. A normal body temperature can range from 98.6 degrees Fahrenheit or 36.5 degrees Celsius to 99 degrees Fahrenheit or 37.2 degrees Celsius for a healthy. A person's body temperature can be taken in any of the following: orally, rectally, axillary, by air, or by skin. And today I'm going to show you on how to take body temperature through orally. First, introduce your name and explains why you need to take the body temperature. Then disinfect the equipment used. Replace electronic thermometer in the base holder if required for charging. Perform high hygiene and don gloves every time you're taking oral temperature to prevent yourself from getting contaminated. And then clean the thermometer using the alcohol wipes. Insert the thermometer in a probe cover to protect the thermometer from being contaminated. And then take the thermometer and insert it in the patient's mouth and have the patient lift up their tongue and put it under the tongue. Instruct patient to close mouth without placing teeth on thermometer. Then wait until the beep was heard. Then remove the thermometer probe and place it in biohazard waste container. Then record in patient. Blood pressure is the force that blood pushing against the artery wall during contraction and relaxation of heart. The two numbers recorded when measuring blood pressure. The higher number or the systolic pressure refers to the pressure inside the artery when the heart contracts and pumps blood through the body. The lower number or diastolic pressure refers to the pressure inside the artery when the heart is at rest and it fills the blood. Both systolic and diastolic pressure are coded as or millimeters of mercury. Equipment used for measuring blood pressure is sphygmomanometer. The normal blood pressure systolic is 120 and diastolic is 80 for adults. The factors that influence blood pressure are the environment, the age, the physical activity. And lastly, we're gonna do is to measure the blood pressure. And to do that, we want to make sure that the patient is in sitting down with their arm at heart level and their legs are uncrossed. Then get your stethoscope and blood pressure and make sure to get the right size of cuff for your patient's arm because if you use the big or a small cuff, it can affect the palpate the brachial artery because we're going to be getting our systolic number, which is the top, and this is the first sound we hear, and our systolic number, which is the bottom, and this is the end of the point we hear. The cuff 2 inches above the bend of the arms. Then we're going to palpate the brachial area using stethoscope or your fingers. So I'm going to inflate the cup around 130 millimeter of mercury or more than. The reason for this is to avoid the oscillatory graph that can happen in some patients, especially with hypertension. Look at the gauge of our blood pressure cuff so that to make sure we're really noting those points because it is going to tell our systolic and diastolic number. Then I'm going to deflate or let it fall around 2 millimeter mercury per second, and we're listening for that first sound is our systolic number. It was 110. And then the last sound we hear is our diastolic number. It was 78. Once have you done reading, make sure that you fully deflate the cup of air and take the cuff off from the patient and clean it or sanitize it and document the patient BP and what arm you have taken. The normal blood pressure is 120, the systolic, and 80, the diastolic.